Welcome back into Main Street Living. Now, guys, one of the first things you notice when you meet someone new is their smile, right? I mean, a healthy smile can make a great first impression.
So true, Danielle. But a healthy smile is much more important than just to help us look good, of course. In fact, an unhealthy mouth can lead to an unhealthy body. And Dr. 𝗿𝗲𝗡𝗆 with Bonita 𝗿𝗏 Dental Care is here to give us some information about dental implants. Welcome to the show, Doc. How are you?
Hey guys, I'm doing great. Thanks for having me. I'm honored to be here, and thank you very much.
Yeah. So you do a lot when it comes, with the mouth, right? So what are some of the benefits to having dental implants over something like dentures?
Oh man, I mean, I could go for hours talking about, the difference between having dental implants against regular like false teeth. But basically, just imagine this, when you have false teeth, things fumble around, they're painful, they're hurting, they're moving all over the place. And somebody that has dental implants is like having just your regular teeth, like the ones God gave you.
Yeah.
With them, they're painless. They can just pretty much have a great smile. So it's like day and night, 100%. Yeah.
Now, dental implants, is that something that anybody can be a candidate for?
So nowadays, with the different type of implants that we can provide, I can fairly say that, almost 99.5% of patients that walk through our door can actually get dental implants with us. Yeah.
Oh.
Okay, so you've got this thing, and help me if I mispronounce it, but like, who would be a candidate for something called zygomatic implants? Is that how you say it?
What is that? Q, you're throwing out these terms.
Actually, yes, a zygomatic implant, is an implant is a really specialized implant that we actually use when somebody is not a candidate for regular implants. So like the ideal candidate for a zygomatic implant, somebody that has been either turned down before or has been told that they don't have enough bone, because it's really common, somebody gets told that they don't have enough bone for regular implants. That's when zygomatic implants, are the answer, the solution for that.
Wow.
Okay, so enlighten us a little bit. If they don't have enough bone, then how can these zygomatic implants be the answer? How does it work? How do you do it?
Yes, well, those zygomatic implants are really specialized implants that anchor from different bones than regular implants anchor from. So they just use different bones, actually better bones. You just need to be, trained and have all the technology and the supplies to do that procedure. But definitely, so that's the big difference with them.
Okay, so you're talking with a person who was a scared kid to go to the dentist, right? So, you're talking about bone and all types of extra stuff. What extra training is needed, to place a zygomatic implant in someone's mouth? It sounds like a lot.
Yeah, well, actually, there's definitely a lot of extra training that somebody or a dentist needs to be able to do that. They don't teach you that at regular schools. They don't teach you that at regular implant courses. You really need to go and find the most advanced courses and, try to find the mentors and people to show you this. I was lucky enough to have been able to find those mentors, and they were like gracious enough to teach me how to do it. So I went travel, across the country, travel even across the world to be able to perform this. And now we're lucky enough, and our patients are lucky enough that we can provide that for them.
Oh, man. And I'm like Quincy, as far as I don't want to feel anything. Does this hurt, or do you give us tons of Novocaine, or do you put us to sleep? What is the process like, and how long does it take?
Yes, of course. I wouldn't want to feel anything. I mean, if I was the patient, I didn't want to feel anything either. And, actually, we do a lot of different types of sedation, but to put it in a nutshell, you'll come in the morning, you'll be put to sleep, and then you wake up and you have implants in and teeth on your mouth, so you won't feel like zero, nothing.
Ooh.
Okay, so once they're in your mouth, okay, do they look and act like regular implants, or is there something
100%.
special?
No, 100%. Once they're in your mouth, they look and feel like regular implants, and actually you don't feel anything. You don't ever feel your implants. The only thing that you feel is your teeth. You just feel your new smile. So your implants, you will never even be aware that you have them in you.
Wow.
Okay, so you still feel your teeth, and this is what I'm curious about. Like when you're chewing and whatnot, Do you still have all the same nerve endings?
Well, you don't have your natural teeth anymore, so you don't have the nerve endings that your natural teeth used to have. You know, the
Huh.
teeth that God gave you, but now you have some implants in there. So, but you're able to chew, you're able to smile. They don't move. That's just like having the teeth that you patients had, years before.
Okay, so what you're saying is they are definitely safe. All right. So can you give us an idea of what the success rate is as far as getting them in?
Yeah, in my opinion, zygomatic implants have a better success rate even than regular implants, just because of the fact that they hold from better bone. They just hold from better and stronger bone than regular implants. Anyways, like I said before, if you are trained properly, if you do things carefully, and if you have the proper technology to be able to diagnose your patient, then they're very, very safe, perfectly safe.
Hold on, I have a question now. What if a person comes in and they don't really need, like their teeth are okay, but they just don't want to, I don't want to fill cavities. I don't want to fill any type of root canals. I don't want to fill anything anymore. Could I just get my teeth out and get these implants?
Well, no. It depends, man. I mean, no way. So,
so no cheating.
No cheating. If your teeth are perfectly fine, you are going to keep your perfectly fine teeth. But you know what? That's a great. I'm glad you asked that question, because yeah, we do have a lot of patients that want to take out all their teeth and get dental implants. Definitely not the answer. A dental implant is the best answer for somebody that has no more teeth, or they are going to lose their teeth. Then they're wonderful. Yeah, but not a replacement for your natural ones.
Quincy, you crack me up. I think the insurance company would give you a big denial. No,
right.
We're not going to cover that for you. But obviously, this is very important, and not just medically, but aesthetically for people who are looking to do something like this. So where are you located? And I assume you can get these all over the country if people are not in your area. And how can people learn more?
Yeah, for sure. I mean, we actually have people on the fly, for other parts of the country to get it with us. We're also like one of the very, very few offices in the whole US that can actually provide zygomatic implants. So that's why people travel from different states. But anyways, we're in San Diego. We're in the south part of San Diego in Chula Vista. And, if somebody is interested in this, somebody has been turned down before, think that they cannot get implants, believe me, they can. So they can reach out online, bonitadelrey.com, or our phone number is over there on the screen. Social media, we're easy to find. We're here.
All right. And only people who need them call. Quincy, that's not you. Thank you so much for joining us today, doctor. We appreciate it.
Thank you, guys. We'll see you soon.
All right. Coming up next, we're going to talk about another kind of artist. I call him an artist too, but we will explore more art coming up. Stay with us.